Welcome, Kirollos. Good to see you here today.
Likewise, Alex. Thank you for having me.
I'm delighted to have you on the podcast. We've connected in a few different places over the last couple of years, really, and I'm really looking forward to our conversation. And today we do have some questions from listeners, so we'll get to those in just a little bit. But to start us off, if you could just share a little bit about who you are and something about the work that you're currently doing.
Sure, absolutely. And again, thank you for having me. Really excited to spend a little bit of time with you. To briefly introduce myself, my name is Kirollos Hann. I am a pharmacist by training. I went to school down in Florida here in the US and did a couple of years of residency. I'm currently the director of pharmacy at Minnesota Oncology. Minnesota Oncology is part of community oncology. It's part of a very large network called the US Oncology Network. And I'm also an assistant professor at the Mayo Clinic College of Medicine in Rochester, Minnesota. Outside of my, I guess, 8 to 4, 7 to 3 kind of job, I am involved in a lot of organizations within the pharmacy industry. I sit on many boards, chair a lot of committees. I value education, peer-to-peer education, which has really driven me to become more and more involved in the field. Clinical research and those kinds of things, publications, those are also some things that I've generally have been involved in over the years. And I think it provided me with a lot of satisfaction from my career outside of, again, just the standard day-to-day job. But in my current role as a director of pharmacy, I really oversee all of pharmacy operations for our organization. We have 14 clinics. We have compounding services. We have oral chemotherapy services. We have various clinical initiatives within the organization. We run P&T committees. So really just being part of all of that work for our organization.
And a lot of our conversation in today's episode is really going to focus on education for and by pharmacists. But I do want to ask before we get to that, how on earth do you find the time? Because this is a lot to have on your plate.
No, of course. I think, and my wife and I talk about this all the time, just, the number of hours in a day and how we keep bouncing around. But it's little sleep and a lot of caffeine is what I like to joke about and say. But I know, I think within pharmacy, we have seen so many different trends within the pharmacy field, right? During the pandemic, we've seen a big shift toward virtual work. Post-pandemic, we've seen a mass exodus of people going into the pharma space. And I think it's because pharmacists oftentimes fail to recognize opportunities outside of their day-to-day job that they can become more and more involved in, which really leads to great satisfaction. I personally enjoy what I do. So outside of my work, when I do get involved in educational opportunities, whether that is a publication, whether it's a national presentation, although I'm investing a lot of time outside of my work hours, and sometimes that takes away from family time, so it's going to be also important to come up with a balance. Just the enjoyment of that, to me, it's not more of, it doesn't seem like a task that I'm doing or a job that I have to do, but more of one of those activities that I actually enjoy doing. It's more of a hobby to me to some extent. So I think that has helped me, gain a lot of satisfaction, as I mentioned, from my career and from the pharmacy industry outside of, again, just a day-to-day job. So it's a lot of work outside, but generally, if you enjoy it, it doesn't tend to be too tedious.
Yeah, it's something that your passion is clearly evident. And you did mention that pharmacy it's ever evolving. It's undergoing a lot of change at the moment. What are some of the kind of key trends that are contributing to, I guess, two things. On the one side, there's the passionate pursuit of the things that interest you, one within pharmacy. On the other side, there are trends that are driving pharmacists out of pharmacy into non-clinical roles. What's
Absolutely.
your take on what's going on there?
It's really multifaceted. Number one, I think within the healthcare field, there is a significant gap in measurable criteria that a pharmacist should and should not be measured on. And those criteria within organizations vary significantly if they are present. And they don't dictate how a pharmacist should advance in their career. So oftentimes pharmacists who are in a certain role are challenged by their employer because there's a lack of metrics to measure productivity, yet we know the value of pharmacy across the board. There's a lack of metrics that incentivizes them to become more involved and get their name out there and get the name of their health system out there. So then oftentimes people are finding themselves making X amount of dollars per hour in their day-to-day job. They're overworked, they're short-staffed, potentially underpaid, or not getting adequate enough raises year over year to demonstrate the value and the worth that they bring into the organization. So it brings in just a lot over time. It tends to be a little bit, I guess it weighs on the employee and on that pharmacist. And I think that's where we see a shift. I think also employers. Now, I understand to some extent, some clinical roles and some pharmacy roles may not be remote eligible. You know what I mean? Sometimes pharmacists have to be on site, work a 7 to 3, work a 8 to 4, work a 9 to 5. Whereas in other areas, employers can come up with unique opportunities to allow that pharmacist to work outside of the office, work from home, work remotely, create your own flexible schedule. And as long as you have measures that the work is being done, that's, in the grand scheme of things, the goal. So I think the lack of or inability to measure quality of pharmacy, as well as the lack of some being able to shift toward unique job roles, has really played a burden. And we understood that. I think the pandemic really brought that to light in the grand scheme of things, where we end up being in this situation where we are today. Now, again, and some just seek a higher, monetary compensation outside of their day-to-day job. So there are a subset of them that may want to exit the field just because of other opportunities. But again, we don't know how to incentivize pharmacists if they're BCOP certified. We don't know how to incentivize pharmacists if they sit on committees with national organizations or are board members of national organizations. We don't know how to incentivize pharmacists who are involved in research and who publish. And there's a lot of heterogeneity there. So I think that's what has led to some of this.
And do you see employers beginning to take steps in order to be more creative in terms of how they're incentivizing pharmacy staff and measuring their contributions?
They're trying, to be quite honest with you. We're trying to come up with unique, at least I'll speak for employers that I have experiences with. Some have been unfortunately too late to the game, and then you may be in a critical staffing shortage, right? Or having some significant constraints on your current employees. Others have been trying to, and I think some are doing it better than others. Some have really come up with unique ways. Again, like I said, one of my organizations that I've worked for, our entire oral chemotherapy department that wasn't dispensing medications. So they're not physically dispensing, they're doing clinical work. They migrated that entire team to work from home. Okay. Brought a lot of job satisfaction to that team. Whether that team is sitting in a cubicle in the office or sitting in their office at home, their productivity actually measures out a lot better in the home. Now, yes, you see some variability maybe in the hours worked or in the time worked. But again, we saw pretty significant productivity around that. So yes, I would say employers are working on it to some extent. I think one of the challenges too is just a metric, again, around pharmacists, I think compensation as well, and levels of pharmacists. I'll give you an example. I work with an organization called APSHO, which is more so focused on APPs, so advanced practice providers. And they came out with a really great rubric around metrics to measure an NP or a PA. How many patients should be seen a day? How many things should be done or tasks, etc., and tied certain monetary metrics to it to try and provide guidance. And I think pharmacy there's a significant gap there in the pharmacy world.
How was that metric creation or development received? Okay.
Yep.
Oh, yeah.
It was, so they collected the information through surveys, and it was disseminated through their website and through their publications. And it was it's been received great by many organizations. I actually brought that to our director of clinical practice here, who oversees some of our nurse practitioners. And we brought that to a board level of trying to level set expectations for nurse practitioners.
Mm-hmm. That's interesting. And of course, so we've been talking about what's going on inside the clinical space in terms of driving people out, strategies to retain pharmacists. But for those pharmacists who leave, you mentioned a lot of them are heading toward industry, to the pharmaceutical industry. What are some of the kind of non-clinical opportunities for pharmacists that you're seeing right now? And what are some of the challenges that they might be encountering as they migrate from a clinical role into non-clinical roles?
That's a great question, Alex. Pharmacists can, the amount of things that pharmacists can get involved in and the roles that they can work is just everywhere. There are pharmacists that work to like they actually work just to create educational content for organizations or educational companies. That has so many levels. There are pharmacists that can have jobs that bring in funding opportunities to then deliver educational opportunities. There are pharmacists that can work for things like NCCN. I know a medical writer who's a pharmacist who works for the National Comprehensive Cancer Network. There are pharmacists, again, that could go into the pharmaceutical industry, but even under the pharmaceutical industry, the variability of jobs there is significant. There are pharmacists that could be more sales centric, could be more medical education centric, and that medical education could be a role where they're providing medical education to HCPs, or it could be providing medical education or developing education for internal purposes, so for their own company. So many different things that a pharmacist can do really across the board. And it just really depends on what they're passionate about. And then also outside of clinical roles, which to me, that's a role where you're in direct patient care within organizations. Pharmacists play significant roles as well, right? You can move up the administrative ladder. You're no longer part of that direct patient care. But I know pharmacists that are part of very large practices who work to build relationships with manufacturers. A colleague of mine works for Florida Cancer Specialists, a very large practice in Florida, and all he focuses on is payer relationships. How could we connect with payers to build relationships? Right. And from that, we could get contracts with pharmaceutical companies, with payers. There are pharmacists that can work in IT as well, right? Developing various technologies for health systems, developing technologies to be utilized elsewhere. So numerous different things. Now, some of the challenges people can face if you're shifting from clinical practice to something like that, unless it's something you've invested a lot of time in, there could be some knowledge gaps there to become successful in whatever that shift may be for you. But also, I think I find that particularly those who practice in oncology, a lot of pharmacists end up missing the direct patient impact or the patient touch. Oncology and hematology are very unique areas of pharmacy. A lot of people can get into this field just because of the personal experience they may have had with it in the past, whether through family, friends, themselves. So oftentimes they have a special bond, I think, to their patients. So leaving that patient care is sometimes a bit of a challenge for some.
And I should say that a lot of listeners of the podcast are pharmacists, so they are going to totally understand all the acronyms and abbreviations, but I will make sure to have links in the show notes for non-pharmacists. It's a very acronym-heavy area. And this is probably a good time actually to just pop in a question from a listener, Nicholas Planchard, who's also a pharmacist. He asks, oncology seems to have a steep learning curve for many pharmacists. How do you suggest that pharmacists overcome oncology's intimidation factor? You were talking about oncology there and its unique characteristics for pharmacists.
And that's an excellent question. And many people have asked me that question. As an oncology pharmacist, I can't stay up to date with everything going on in oncology. So a couple of things. I have not come across any school curriculum, a Pharm.D curriculum, or whatever curriculum you're part of, that prepares a pharmacist to go into oncology. It's too large.
Interesting.
Oftentimes you may get an elective where you have a 1-hour course every week or so for a semester, but it's not really robust where it's focused on oncology, and there's just so much going on. So I encourage pharmacists to seek out extra training. What is that? Residency training. Although you would invest 2 more years potentially of your life focusing on a general residency year and then maybe an oncology pharmacy year, the ROI, the return on investment, is definitely there if you're truly passionate about oncology. 2, buying or getting some type of access to resources that are preparatory material for the BCOP exam. The BCOP exam is the
Hmm.
Board Certification Oncology Pharmacy. Those are great resources. They cover some of the main cancers. There are videos that experts and faculty actually conduct to help tie in the chapter and the written material to a live presentation. And that can help pharmacists prepare a little bit in terms of oncology knowledge.
Hmm.
And I would say you have to love literature. We have to read a lot. We have to evaluate a lot of clinical trials, especially in areas where you're seeing a lot of opportunity, Me Too options or very similar options, and trying to
Mm.
evaluate standards of care and things like that. Um, so there just has to be a passion. It's not challenging, but there has to be a passion for it. And I think now within oncology, because of how large oncology is, and I started off by saying I don't know everything in oncology, but there's foundational knowledge that's needed for a pharmacist to be successful in oncology. If you achieve that foundational knowledge, you will know how to navigate everything in oncology, right? If you understand tyrosine kinase inhibition, you'll understand the 80 drugs in that class, generally how they work. You won't know all the kinases or targets that they hit, but you'll know what it means to be a tyrosine kinase inhibitor and how that pathway works. And as we identify various targets in different cancers, that's where a kinase inhibitor could work. If you understand general concepts about immunotherapy and the immune system, if you understand general concepts about cytotoxicity and standard chemotherapy, you start to then, once you come across a drug or come across a disease state, you start to think of, okay, I know that this drug works this way. I know this cancer behaves this way. That's why it makes sense to couple this drug into this cancer. So it's extremely difficult to stay on top of everything. And I generally recommend to people pick a couple of cancers or disease states that they like the
Mm.
drugs used, they like the patients, and become an expert at it. Know the ins and outs, know the nitty gritty, know the guidelines, know the literature, know what's coming up.
Mhm.
Everything else, if you're not too passionate about it, have foundational knowledge. So once you come across those things, you can further seek out the resources and the literature that you need to help answer any questions that come up.
I love that. Those are really clear stepping stones, actually, for any specialization that people
Sure.
are interested in, whether pharmacy or elsewhere. When you're confronted by the intimidation factor,
Mhm.
consolidate your foundational knowledge, seek out resources, and enrich your specialty by really drilling down and building your expertise through practice. I love that. That's a great response. Before we got to Nicholas's question, you were talking about education and the very special affinity that pharmacists have for education. And I think it's fair to say that pharmacists bring a kind of unique value to the field of education because of their role in educating patients, but also educating their colleagues in the clinical context. And you were talking about pharmacists who are moving into non clinical fields, educating HCPs and so on. What is that value that pharmacists bring to education? And how does their niche expertise enhance the learning experience of their colleagues?
Yep. So I think, Alex, pharmacists are uniquely positioned to be excellent educators through so many different avenues, whether that is public speaking and professional presentations, whether it's something pre recorded, whether it's something written, whether it's a podcast, internal within a health system, external outside of health systems, to peers, to patients, to HCPs. And the reason why I think that is a pharmacy or a pharmacist has to wear two hats, right? Number one, you're the drug expert, the ins and outs of drugs. And even when we talked about oncology being so big and you're not going to know everything in oncology, that foundational knowledge just really helps. The pharmacist needs foundational knowledge about drugs and also how to seek out resources to answer questions about drugs.
Mm.
But at the same time, pharmacists also, to an extent, have to be experts in the disease. Not, you have to take the medicine and tie it back to the issue going on. Without that, you only are aware of 50% of the puzzle. You know what I
Mm.
mean? So that's where I think Why pharmacists are so unique? Because they understand the ins and outs of drugs. They understand to some level the degree of the disease and how the drug is impacting the disease overall. And this applies whether we're talking about blood pressure, whether we're talking about infectious disease, whether we're talking about oncology. These foundational bases should be part of every pharmacist's understanding. And that's why I think it really positions them in a great level or at a great level to be excellent facilitators for educational opportunities.
And that's probably a good seg to the next question I have actually from a listener, and I think this question gets at your point about foundational knowledge, but the question is really about how do you decide which pieces of that knowledge to really focus on. So I'll ask the question because it's much better than my paraphrase. So Melanie Paget, who's also a pharmacist, asks, since most pharmacists have to be knowledgeable in so many therapeutic areas, what level of detail is effective for pharmacist education? So for example, she says, pharmacists are most knowledgeable in pharmacologic therapy, but how do you divide the time with other areas such as diagnosis and non-pharmacologic therapy, and so on?
Yeah, and I think this is a significant challenge in retail pharmacy because you have to stay on top of so many different drugs that it sometimes does pose challenges for a pharmacist to be able to become more acclimated with certain disease states as much as everything changes. You know what I mean? I think pharmacists who are specialized, so those that go into critical care, ambulatory care, nutrition support, nuclear medicine, oncology, we become so focused that it's all we see day in and day out. So it's like osmosis, right? We learn that foundational knowledge and we use it every single day just in a focused area. So we get to learn more as we practice more and as we see more. The side of it, again, where, like I mentioned, is a little bit challenging. For me, I am extremely rusty in critical care. I'm extremely rusty in if it was retail pharmacy because I haven't seen so many of those medications. I'll give you a funny example, Alex. I worked retail pharmacy part-time for 11 years and finally left it. But
Oh, really?
it
I
was
didn't know that.
every time I'd walk into a retail pharmacy, there would be a new insulin. The number of insulins and brands and generics and inhalers and all these different things, it just creates a lot of challenge. And it is challenging to be a pharmacist. I'll give you that. That's why I always encourage people to try and specialize, whether through residency opportunities or not, and find an area of pharmacy you're very passionate about. My wife, for example, she does internal medicine. She's a pharmacist as well. She sees everything that walks in through the door, but she works for a government agency who generally serves veterans. Her population is generally unique. Now, although they walk into the hospital, get admitted in the hospital for so many different reasons, your infections, your maybe a heart attack, maybe a stroke, maybe hypertension, but that's what she sees day in and day out, that she stays on top of those specific things that she's seeing on a regular basis. I'll tell you this, there are cancers that come through in oncology, extremely rare. I couldn't even begin to tell you what the standard of care is going to be, right? But again, we know the tools we need to tap into to tell us, right? I would first pull up NCCN guidelines. I lied. I'll probably do a Google search to try to get some basic information. But we're going to pull up NCCN guidelines, right? We're going to look at what's going on here. As I mentioned, there could be some preparatory material that covers it. But again, if it's a super rare cancer, it may not even be in preparatory material because that's not what they want you to focus on. You're trying to really understand foundational things. So those are ways I would go about it. I strongly encourage people to specialize. Nothing against retail pharmacy at all. I have family members who are retail pharmacists as well. But like I said, I did it for a very long time. But I encourage pharmacists to specialize in an area that they love. And if you want retail as part of your career path as well, that's always something that was going to be available, I think, for pharmacists to be a part of as well. But I think that's one of the most challenging areas to stay on top of disease states and linking everything out of sight of just that pharmacological knowledge that we have.
And you've got to make things manageable for yourself is one of the kind of key
Absolutely.
messages there I'm hearing. I do want to dig into the Google
Yeah,
thing for a moment. When you're using Google, what's your strategy?
sure. Google is a smart search engine, right? And I think as pharmacists or HCPs the person using the tool is going to have an eye for certain things based on who you are and what you're looking
Mhm.
for, right? A patient Googling their cancer or Googling their treatment, they're not going to know that when they see a link to PubMed, that's probably going to be a primary literature article that could bring you to what you're looking for. They
Mhm.
may click on, I don't know, canceristerrible.com and then just go down a rabbit hole of incorrect or maybe not vetted information specific to that patient. So these are kinds of things that when I Google something, it's oftentimes when I get my search results, I'm looking for links to primary literature, maybe a link to a guideline, maybe a link to an educational session. We
Yeah.
know pharmacists generally, if you utilize something like Google for educational sessions or material, you also probably have a couple of vendors that you have utilized in the past, right? There
Mhm.
are big names out there, right? You have Medscape, you have Enclive in oncology,
Mhm.
you have Pharmacy
Yeah.
Times in oncology, so many different things that we can look into. So those would also probably be things I try to tap into. And then
Yeah, that's interesting.
it's always drugs. Anytime you
Yeah.
search for drug, you can just go right there. And oftentimes, like I'm doing that to pull up a package insert to maybe
Mhm.
build out things internally or work on that. But oftentimes, most drugs, it'll be the drugname.com, right? So you may not
Mhm.
even need to do a Google
Yeah.
search.
Yeah. So it's expert sifting. You've been talking about pharmacists as educators for patients, for their peers. What what education do pharmacists need in order to, or maybe rephrase that, what are the unmet education needs you see in the pharmacy space to really support the work that pharmacists are doing?
I'll speak to within oncology, the unmet need in terms of, I'm sorry, Alex, let's start. So just could you ask me that question? I'm not sure I understand the question entirely.
Yeah, absolutely. What unmet needs do you see in the education space for pharmacists? And I guess the second part of that question is how can continuing education support the work that pharmacists are doing?
That's a great question. Continuing education is extremely valuable. I think one challenge in the continuing education space, number one, is how much continuing education is out there, right? How
Right.
many vendors and how many deliverables, and we have 24 hours in a day, right? 7 days a week. And it's sometimes hard to sift through which educational program or opportunity I should navigate with the numerous deliverables that are out there. So that's, I think, one of the challenges. Another challenge is I think there isn't enough education out there to really tap into standards of care and where there's a lot of ambiguity around standards of care. So
Mm.
I'm talking about a disease state where you're 2, 3 lines in and there are 10 therapeutic options. How do I navigate between regimen A, B, C, or F? And I think a great delivery of education around those kinds of gaps tends to be some type of debate format where you get 2, 3 faculty members who are thought leaders, content experts in that disease state,
Mhm.
and they begin to provide perspective, right? And if there's opportunity to even an audience to have if this is a live program, definitely great. If there's an opportunity to bring in audience members into this and submit questions as things come up to where the audience is even sort of part of the debate as well. These kind of interactive things, I think,
Mhm.
have been limited. We don't see a lot of debate format structures focused on pharmacy, but there's tons of didactic lectures out there. This is the disease. This is the treatment algorithm. These are what you need to think for monitoring whatever, and this is how you educate patients. It tends to be a cookie cutter thing, and I don't really
Mm.
think that there is a gap there, but it's more so of just how do we delve deeper and then provide better understanding. And I also think, you know, faculty is very important. The actual faculty member and the ability to deliver education. Not all educational deliverables are, sometimes just the faculty, depending on, again, how smart they are, they can dig so far into the nitty gritty that they begin to lose their audience. So I think too, as companies and whatnot develop educational materials, just looking at the faculty and their ability to tie or bring in so many audiences or appeal to so many audiences, those who may not know oncology and those who are experts. And how do you provide a deliverable that's just a great, regardless of who is the audience? So I think those are areas where we can continue to improve upon.
That's really a great kind of roundup of the potential for different education types for pharmacists. And just to finish off our conversation here, because we're up on our time, what would you say to somebody who, a pharmacist, perhaps like a mid-career pharmacist who is looking for more opportunities to expand their role in pharmacy, but is feeling a little bit stuck? They're not quite sure where they start.
Yep.
How would you advise such a colleague?
I tell this to every level of pharmacist, whether you're a student, whether you are a resident, or whether you're a new pharmacist right out of school, or you're a senior pharmacist. Publications. You don't have, I think there's a misconception around publications. You don't have to run a head-to-head clinical trial and publish results. That's not what that means. You can publish a unique topic about a drug based on a side effect that you've seen, a case report. You can publish a review article about a disease state where all of a sudden in 1 year, we went from one therapeutic option to 5. We've seen that in oncology. You can publish around a controversial debate. You can publish on anything going on in legislation that impacts pharmacy. You just need to really find the ability, the right magazine. And the reason why I say this, publications gain attention of others. So depending on the journal, depending on the topic, everyone who is looking to develop something or find a thought leader, if you went through the publication process, got your paper peer reviewed, and got it published online, that means people found value in what you had to say, that it's worth putting online indefinitely. Publications don't come down. And then when this pharma company or this educational company or this medical writer is looking for somebody, they want to look at a certain topic or a certain drug, guess what they do? They start to Google, right? And they start to Google, and then they come across that paper on PubMed that Bob Smith wrote from Florida, right? And, they read through it. This is really interesting. There's his email, or I can, again, find him on LinkedIn, find him on Google, and they will reach out. And you'll be surprised at the number of opportunities that are available. I'll give you one example, Alex, just for the sake of time. Out of residency, I value GU cancer, so genitourinary cancers. Bladder cancer is something near and dear to my heart. I love the disease. I know the ins and outs of it. As I was wrapping up residency, there was an explosion of immunotherapy options for bladder cancer over a short period of time. I published a paper. I looked at all the clinical trials, wrote up a review article, published it online in a reputable pharmacy journal. A couple of weeks later, I was invited by one of the largest oncology organizations to give a platform presentation on bladder cancer. That wasn't something I signed up for. They reached out to me and offered that to me. And it was a BCOP presentation. So BCOP, they're a little bit beyond CE presentations. So it was a little bit more rigorous.
Yeah.
And so those are things that one thing will open up the window to another thing. And guess what? At those conferences, you're giving a presentation. They see that you're a great public speaker. Let's see if this guy wants to work with us on whatever other initiative or other project. So those kinds of things continue to open many doors for people, depending on, again, how much you invest into it. But again, publications have been one of the most, I'd say in my career, have been one of the most significant and impactful things. And they're also, if you enjoy research and learning a little bit more about whatever disease states, there's some value there for yourself as well.
And publications are, there's a barrier for some people to writing and thinking about writing. Is that something in pharmacy, or are pharmacists trained to think about writing
Yep.
as part of what they do as pharmacists?
And that's a great point, Alex. And not everybody is a great writer. Not everybody has passion for it. But this is also too where I think pharmacists, if they're a great educator, could you have an intern or a student that is has time, wants to get published? Could
Mm.
you work with them, work with other members of your team? If you have an academic affiliation, somebody within your college or university, where you can leverage someone else's expertise if you can provide guidance on where you want something to go. So you don't always have to be an expert medical writer that this is all you do day in and day out. But also keep in mind, writing, the more you read, the better you write. So
Yeah.
it becomes a style. You understand if you read New England Journal of Medicine articles, Lancet articles, all these different things, you understand how a publication is going to look like. So that will help also people refine that skill again in an autopilot fashion, which I think would help as well. But I'll give you another example. I've partnered with numerous students where we've
Mhm.
written review articles together. I gave them direction. I gave them an opportunity to get published. It's also publication for myself as well. And I would have 4 or 5 of them write different sections of a paper. It comes back to me. I put it all together, make sure it flows nicely, that the writing styles match from different people, organize it all together. And we've gotten multiple papers published that way, where it's beneficial not just to you as a pharmacist, but also to others and upcoming learners in getting their name out there. And again, putting it on their CVs and their resumes and being attractive candidates for residency programs and jobs and such. So a lot of opportunity there that it's not just whether I don't like writing or I like writing or I'm good at it or bad at it.
It's a win for everyone.
Right.
Kirollos Hanna, thank you for educating listeners of Right Medicine about pharmacists as educators. Appreciate
My
your
pleasure.
time and energy here.